Hello everyone, my name's JBRNBSN, and in this video I'm going to talk about the 55 most common words used in NCLEX that you need to know so that you'll be able to answer the questions correctly. So you need to know these words by heart. And also a disclaimer, I said asphyxia. Another word for it is choking, and I also said chain strokes respiration. It should be chain strokes respiration without the R. So without further ado, let's get started. Alright, these are the 55 common words used in NCLEX that you need to know. Importance of enhancing your vocabulary to answer questions correctly. So this is not in any particular order or in any alphabetical order. The first word that is very famous is the word snugly, SNUGLY. When you see this word, it means comfortable, cozy, and it fits well. So that's snugly. Number 2 is the word paresis. Paresis, or in other term, it is muscle weakness. So when you see paresis, it means muscle weakness. The number 3 is paresthesia. Paresthesia means burning, tingling, or prickling sensation in the hands, arms, legs, feet that can also occur in the other parts of the body. Number 4 is presbycusis. It means age-related hearing loss, the gradual loss of hearing in both ears. The 5th word is tactile. It means sense of touch. The 6th is diplopia. It means double vision. The 7th is tunnel vision. When you see tunnel vision, it also means peripheral vision or loss of side vision. Next is we have strabismus. It means condition in which eyes do not line up with one another. Number 9 is hyperopia. When you see hyperopia, it means far-sightedness. It means you can see distant objects clearly. Number 10 is the word swaddling or swaddle. Traditional practice of wrapping a baby up gently in a light, breathable blanket to help babies feel calm and sleep. So, for example, when you answer a question in NCLEX and you see a swaddle in the choices, that's usually the correct answer depending on the question being asked. So that's swaddling. Next is myopia. It means nearsightedness. It means you can see objects near to you clearly. Number 12 is cohort. It means a group of people with same illness placed in the same room. So you cohort. Number 13 is bradykinesia. It means slowness of movement. It is one of the cardinal signs of Parkinson's disease, so that's bradykinesia. Number 14 is rigor. It means persistent and involuntary muscle tension or increased muscle tone. It is one of the cardinal signs of Parkinson's disease. Number 15 is muffled. Muffled also means distant, faint, or weak. So NCLEX uses, instead of muffled, they use distant, faint, or weak. It's like heart sounds. Muffled heart sounds, which is a clinical sign of pericardial tamponade. So what are 3 clinical signs of pericardial tamponade? We have low blood pressure, muffled heart sounds, and jugular neck veins. Number 16, we have ataxia, presence of abnormal and uncoordinated movements. Number 17, we have aphasia, Language disorder caused by specific damage in an area of the brain that controls the language expression and comprehension, which is the Broca's area. The Broca's area is responsible for language expression and comprehension. Broca's area is located in the frontal lobe. We have 18, agnosia. It means unable to recognize and identify objects and persons. Number 19, we have apraxia. Inability to perform learned or familiar movements on command, even though the command is understood and there is willingness to perform the movement. So that's apraxia. Number 20, we have anhedonia. Inability to feel pleasure. Number 21, we have licorice root. Just remember that licorice root lowers potassium level, so it causes hypokalemia. Number 22, Logan bar. So when you see Logan bar in NCLEX, it is a device comprising of a curved bow-shaped metal bar widely used as part of cleft lip management to maintain post-operative apposition and to avoid excessive strain after chyloplasty. When you say chyloplasty, it means surgical lip restoration for a cleft lip. Number 23, livedo reticularis. So usually this livedo reticularis is, usually you see this in select all that apply. For example, which are the signs of impending death? So livedo reticularis means mottled skin. If you see mottled skin, that would be livedo reticularis. That's the other name to call this kind of signs that you see on the skin that has purple marks, streaks, and spots. And mottled skin or livedo reticularis is one of the signs of impending death. Number 24 is nevus. Nevus means medical term for a mole. Number 25, café au lait spots. It's a French word. It means type of birthmark characterized by flat patches on the skin and is usually harmless, light brown in color, have irregular edges, and vary in color. So what you need to know is having more than 6 spots suggests neurofibromatosis 1. It's a defect. So that's café au lait spots. More than 6 spots suggest neurofibromatosis. So 26, we have asphyxia. It is a condition of deficient supply of oxygen to the body that arises from abnormal breathing. We have chain strokes respiration. It means condition that causes abnormal breathing during sleep. It includes apneas or periods of stop breathing after deeper and sometimes faster breathing. So a person with chain strokes respiration usually has fast breathing, and then there's a period that he or she would stop breathing. So that's chain strokes respiration. Also one of the signs of impending death, chain strokes respiration. 28, diaphoresis. It means cold, clammy, sweaty skin, usually caused by hypoglycemia. 29th, we have trisomy 21, which is Down syndrome. So a Down syndrome is extra copy of chromosome. So usually the normal number of chromosome of an individual is 46, which is 23 from each parent. But with Down syndrome, their chromosome is around 47. So extra copy of chromosome. Number 30 is melena. When you see melena, it means black tarry stools, which indicates bleeding. Hematemesis. Hematemesis is vomiting of blood. 32, we have hyperemesis gravidarum. This is a rare disorder characterized by persistent nausea and vomiting during pregnancy. So what you do with this kind of patient is to encourage them to eat cold and dry foods such as crackers, and then drink small amount of liquids with meals. 33. Nystagmus. It is involuntary rhythmic side-to-side, up and down, or circular motion of the eyes that occurs in variety of conditions. It is usually caused by miscommunication between the eye and the brain. So that's nystagmus. Number 34, we have oculocephalic reflex. If you see this word in NCLEX, it means doll's eye. Oculocephalic reflex or doll's eye is a reflex eye movement that stabilizes images on the retina during head movement by producing eye movement in the direction opposite to head movement, thus preserving the image on the center of the field, also called vestibulo-ocular reflex. You can see this on comatose patients. The examiner observes a positive oculocephalic reflex when the patient moves their eyes opposite of the rotation of their head, such that their eyes stay looking forward. So it's like a doll's eye. So oculocephalic reflex is doll's eye. Number 35, we have Cullen's sign. It is a superficial edema with bruising in the subcutaneous fatty tissue around the periumbilical region, usually caused by pancreatitis. So that's Cullen's sign when you see a bruising at the periumbilical region. We have Gray Turner's sign. Is a discoloration of the flanks brought about by necrotizing pancreatitis. So pancreatitis, you could either have Cullen's sign, Gray Turner sign, or both. The difference is that Cullen's sign, you can see it on the periumbilical region, while the Gray Turner sign, you'll see a discoloration of the flanks. Number 37 is ecchymosis. When you see this word on your chest, it means discoloration of the skin resulting from bleeding underneath. And number 38 is eschar. So an eschar is a dead tissue, usually leathery, that sheds or falls out from the skin. Its color is usually tan, brown, or black, and may be crusty or leathery. So usually an eschar, you'll see this on patients with bed sores, like stage 3 or stage 4 bed sores. And then 39, we have subcutaneous emphysema. When you see this word subcutaneous emphysema, it occurs when gas or air accumulates and seeps under the skin, where normally no gas should be present. So how would you identify if a patient has a subcutaneous emphysema? Usually when you tap the skin or touch it, you'll see a crunchy sound. You'll hear, not see, you'll hear a crunchy sound. Number 40, we have empyema. It is a collection of pus in the cavity between the lung and the membrane that surrounds it. Number 41, we have Allen's test. So when you see Allen's test in your NCLEX, it is a procedure to find out if the blood flow to your hand is normal. Test done before getting ABG or arterial blood gas though. So this is a standard procedure before getting your arterial blood gas or getting a patient's arterial blood gas. The medical staff should do an Allen's test to find out if the blood flow to the patient's hand is normal. So what's a positive sign for Allen's test? If the hand quickly becomes warm and returns to its normal color, usually within 15 seconds, it is positive sign for Allen's test, and the medical staff can proceed getting a sample blood from the patient's veins. Or artery means one artery alone will be enough to supply blood to your hand. So the medical staff will get blood from the artery. So the medical staff can proceed with ABG after positive result. And also number 42, we have Shovstek sign. Shovstek sign, clinical finding associated with hypocalcemia. The clinical sign refers to a twitch of the facial muscles that occurs when gently tapping an individual's cheek in front of the ear. So that's Shovstek sign. Number 43 is Trousseau sign. Trousseau sign. It is also a clinical finding associated with hypocalcemia. The clinical sign refers to a blood pressure cuff is placed around the arm, inflating the cuff slowly up to 20 millimeter mercury, and then you have to wait for 2 to 3 minutes. Then after that, a positive sign is characterized by the appearance of carpopedal spasms, which involves flexion of the wrist and thumb along with hyperextension of the joints. 44, we have Brudzinski sign. Brudzinski sign. This is a positive sign when a passive forward flexion of the neck causes the patient to involuntarily raise his knees or hips in flexion. So it is usually caused by meningitis, because meningitis causes severe stiffness and inflammation around the brain and the spinal cord. So Brudzinski sign is when there is forward flexion of the neck causes the patient to involuntarily raise his knees or hips in flexion. And 45, we have Kernig sign, another indicative sign of meningitis, wherein there is severe stiffness of the hamstrings, causes an ability to straighten the leg when the hip is flexed 90 degrees. Meningitis causes severe stiffness and inflammation around the brain and the spinal cord. Number 46, dorsal recumbent. When you see this word in your test, it means supine position. So another word for supine is dorsal recumbent. Person lies flat on the back with head and shoulders slightly elevated using a pillow unless contraindicated. Number 47 is orthopnea. Orthopnea is the sensation of breathlessness in the recumbent position or the lying down position or supine, relieved by sitting or standing. Number 48, we have paroxysmal nocturnal dyspnea. This is a sensation of shortness of breath that awakens the patient often after 1 or 2 hours of sleep and is usually relieved in the upright position. So that's paroxysmal nocturnal dyspnea. Number 49, we have orthopnic position, or what you call the tripod position. It is a sitting position or on the side of the bed with an overbed table in front to lean on and several pillows on the table to rest on. For maximum lung expansion, usually patients with asthma uses orthopnic position so that they can breathe well. Number 50 is orthostatic hypotension. When you see this word in your test, it means postural hypotension, form of a low blood pressure that happens when you stand up from sitting or lying down. So that's orthostatic hypotension. 51 is macrosomia, used to describe a newborn who's much larger than average. So you will see this when a pregnant woman who has gestational diabetes gives birth to a child, and then the child after delivery weighs more than 8 pounds and is in macrosomia because of the gestational diabetes. And then 52, we have microsomia. It means abnormal smallness of body structures, which is the opposite of macrosomia. And we have acrocyanosis, bluish discoloration of the extremities due to decreased amount of oxygen delivered to the peripheral part. So acrocyanosis, you will see this with healthy newborns. So their extremities are bluish in discoloration while the trunk is pinkish. So that's normal for newborns. And then 54, we have dysphagia. It is difficulty swallowing. And last but not the least is 55 heterosexual or sexually attracted to people of the opposite sex. So guys, these are the 55 common words that you can see on your NCLEX. I know this is not the complete list of words that you can see on your NCLEX, but if you have anything that you can add to it, please put it or type it down below on the comment section. I hope I was very helpful to you. Please like, comment, subscribe, and share this video to your friends or to other nursing students. See you in the next video. You have a great day, happy nursing, and take care. Bye.